Agree. Okay. Well, so I deal with a lot of fields. So one of them is laparoscopic gynec, one of them is cosmetic gynec and sexology. Let me give you a brief introduction regarding what I do, and then we'll start with women's health topic in detail. So cosmetic surgery is a new branch which has come up, and it is also called as cosmetic vaginal surgery. It majorly consists of reconstruction and also aesthetic gynecology. So reconstruction may be for problems which patients are facing, as in some problems get recurrent infections, recurrent vaginal skin shedding. So there are many problems that they face, and so these problems can also be treated with aesthetic gynecology or cosmetic gynecology. Now coming to women's health, so a girl, as she grows up, her gynec problems keep on increasing, and especially with perimenopausal age setting in and postmenopausal ages have their specific diseases and problems. Let us look at some of these in short, maybe. So speaking in short about the organs, we have the womb or the uterus, as in called in medical language, the lining, which is called as the endometrium, which lies inside the uterus. And we have two tubes on either side, which open into the ovaries, wherein the egg is produced. Now, the mouth of the uterus is also called as the cervix, and it opens inside the vagina or the birth passage. Now, we are seeing that with modern civilization, the role of the woman is changing. The woman is going out, she's working also, she's also at home looking after children. So stress and anxiety has increased to a major level. And this has also in turn caused some gynecological problems. So going down to even the adolescent age group, we are facing, or we have girls who are facing problems, as in they have very minimal flow, the periods are getting delayed. So this usually is the cause for the hormonal imbalance. Now, hormonal imbalance causes ovulatory problems. Ovulatory problems cause hormonal problems, and this is a vicious cycle which finally lands the patient into what is called as a polycystic ovarian disease. So in this, the patients or the girls experience excessive weight gain also. Some of them do get thyroid problems. There is irregular or delayed periods. Some girls stop getting their periods also. They say it's been 3 months or 4 months, I haven't got my periods, doctor. Some of them do complain of excessive hair growth on the face and maybe other body areas also. And so what is the treatment to this? So usually the first line of management is medical management or medicines, or basically it means that we are replenishing the hormones which are deranged or getting them back to normal. So these are hormonal medicines, and also exercise plays a very important role in these polycystic ovarian disease patients. Now, some patients who do not respond to this medical treatment, or really who are full-blown cases of polycystic ovaries, they there are other treatments also, like in laparoscopic ovarian drilling that we have. So this also really helps in getting the ovulation pattern back to normal. Some cases where we really want quick treatment, as in married women who want to conceive or get pregnant immediately, who are not conceiving because there is no ovulation happening, then in that, surgical management is the first line of management. Otherwise, usually we also have I think ReeLabs also has a very good set of medicines which they give for polycystic ovaries, which really works and is helpful, which we give along with the hormonal medications, and it really enhances the treatment pattern. Now, coming to laparoscopy, let me tell you in short what it means. So when we have a big cut like that, we call it as an open surgery. And if there are large masses, then we have a horizontal, a vertical cut also like this, which has its own set of complications. So with open surgery, where we have to have a longer hospital stay and a big abdominal scar, longer recovery period, we have come down to laparoscopy, wherein there are very small, minimal 5 mm cuts which are given on the abdomen. And we have these thin, long instruments, specialized OT setup, which is required for this kind of surgery, and we can nearly perform any surgery through this through these small laparoscopy scars. So you can get 1, 2, or 3 or 4 maximal scars depending on the type of surgery you're getting done. So the advantage is basically very minimal pain and bleeding, minimum scars, and it is a magnified view. So there's higher precision, better results, and early return to work. That's the most important. Patients tell me, doctor, how many days do I have to take a leave, or how many days do I have to do bed rest? And I tell them bed rest is only for 24 hours or not even that. And you can get back to really early after PCOD surgeries. My patients have gone back on the second day also to work. It's really that fast. So there's only 1 day hospital stay. Now, coming to female fertility problems, as an anovulation, or there's a tubal problem, or there is a problem inside the uterine cavity. There could be some tumors like a polyp or a fibroid inside. In these cases, patients come to us with fertility issues, and the first line of management in these cases basically is diagnosing what is the cause for her infertility. So the her infertility causes can be found out by a lot of blood tests, hormonal tests, and also what we do is a diagnostic laparoscopy and hysteroscopy. Laparoscopy, we've already seen what it means. Hysteroscopy basically means that now we are looking inside the cavity. Laparoscopy gives us a view outside the cavity. So we go in through the normal birth passage inside the uterine cavity and take a look inside to look for what is the problem inside the uterus, whether the lining is not good, or is there a polyp inside, is the tube blocked. All that can be found out through the hysteroscopy. So it's a laparoscopy picture, it's a hysteroscopy picture, as we can see. Coming to ovarian cysts, this is a common problem. Many patients or your friends must have told you, oh, I had a cyst, you know. So there are multiple types of cysts that we know of. Majorly, patients come to us with simple cysts, hemorrhagic cysts, chocolate cysts, or dermoid cysts. Now, cyst is basically a fluid collection which forms in the ovary. And sometimes it resolves on its own, or it goes away on its own. Sometimes it does increase in size. If it continues to increase to a sizable size and it starts causing problems, as in patient complains of pain or bleeding irregularities, so then that is the time we investigate. So sonography here is a very important diagnostic modality which helps us diagnose these cysts. And also, of course, bimanual examination that we do gives us also gives us an idea about the cyst and its size and its location. So such cysts can be treated laparoscopically. So simple cysts can be treated by laparoscopy, and this is what we call as endometriosis or chocolate cysts, which is again a rising problem in women, and it is a cause for severe pain and bleeding in young girls or even in adolescents, and up to 35, 40 years of age. Also, women do complain of these chocolate cysts. These are basically blood collected cysts inside the ovaries. So, and the problem is that this also causes the organs to stick onto each other, and which is the cause for severe pain and infertility in these cases. This is, of course, a rising problem. We also call it as endometriosis. The cysts are called as endometriomas or chocolate cysts. Coming to middle-aged women, excessive bleeding is a major concern. We have seen many women from after 35, 40, 45 years of age who complain of excessive bleeding. Doctor, periods are coming very early. They're coming twice a month. What should we do? The bleeding is so heavy. It lasts for nearly 8, 10 days. Well, that is a problem and that really needs to be investigated. You need to consult your gynecologist for the same. Sometimes patients also complain that they are passing clots, huge pieces, they say, or pieces of tissue they are passing. So all this points out to some problem which is underlying for these patients. So the commonest is again fibroids or polyps or endometriosis. There could be a lining cause also. So there are multiple causes for this. So coming to fibroids, fibroids are a common problem. 30% women do have fibroids in their body, but not everybody needs treatment. So treatment usually depends on the location of the fibroid, the size of the fibroid, and the complaints of the patient majorly. So sometimes the fibroids are lying outside the uterus, in the wall, or inside. There could be single fibroids or there could be multiple fibroids. So if a fibroid is lying like this inside the cavity, then what we do is a hysteroscopy. As we said, we go inside the cavity and remove this fibroid. So this is a fibroid inside the cavity. You can see the amount of blood or the vasculature which is being supplied to the fibroid. Then fibroids which are lying outside the uterus like this one, or in the wall of the uterus like this one. Here you can see this patient has got multiple fibroids. So fibroids can come anywhere and anyhow, and the treatment is removal. There is really no medical management for fibroids. Any medicines will just help it shrink to a particular size and then stay there, but the minute you stop the medicines, the fibroid will again come back to their normal sizes. So medicines really don't work in fibroids. The treatment is removal of the fibroid, or as the surgery is called, myomectomy. And since we do it laparoscopically, it's called laparoscopic myomectomy. So it can be done for any size fibroid, especially in fertility cases where it is causing fertility problems. This laparoscopy is the method of choice. And since it's giving very minimal scars, so in the internal scarring is also minimal with laparoscopy. And so if any patient needs a repeat surgery, well, that is the best option. Coming to another surgery, which is one of the commonest surgery, that is uterus removal surgery after a cesarean section surgery. So the commonest causes for this, as we have already discussed, one is fibroids. Another is a lining problem. The lining has gone thickened, then we need to consider hysterectomy as an option. Or there is a adenomyosis or endometriosis problem. There is a prolapse. I'll talk about this in detail. And there could be other causes, as in even malignancy. So talking of a lining problem, the lining could get thickened. There could be adenomyosis inside the lining. There could be also be a fibroid. This is hyperplasia, or there's an ingrowth, which is called as a polyp, or this hyperplasia, if not treated in time, can convert into a cervical cancer. Prolapse meaning the supports of the uterus have become so weak that the uterus has started descending down or coming down from the normal birth passage. So the more it comes down, the more the degree of prolapse we say. So in such cases, if the patient has really completed her family and she doesn't wish to have more children, then removal of the uterus along with the wall suspension is the treatment of choice. And in cases where a patient has to still complete her family, we pull up this uterus with a little mesh and fix it onto the bony prominences, which helps prevent the prolapse. So what are the common problems that women usually face is irregular periods, heavy bleeding, clots, pain during the periods. There could be a lump that the patient feels in the abdomen. Yes, there could be leakage of urine because of these lumps. There's chronic pain or continuous pain off and on in the abdomen. There is dyspareunia or difficulty in intercourse, or there's a postmenopausal bleed problem. All these problems need to be diagnosed early, as in get a gynae consultation done, get a sonography done, and endoscopy is the option or the gold standard for these kind of problems and treatments. So if any woman needs a surgery, you should know that endoscopy is an option. Now coming to your nutrition women do not take care of their nutrition. They take care of the nutrition of their whole family. But when it comes to their nutrition, they are eating their eating habits are not proper. The calorie content is high. Sometimes there is a lot of food remaining, so that needs to be finished. So that is what they really start gulping it down, and that is the cause of these problems. And actually, as age advances, the metabolic rate decreases, and so what the amount of food that you were eating earlier, if you continue to eat the same amount of food now, you are going to start putting on weight, will become flabby, skin becomes loose, and we have all kinds of health issues happening. So calorie content should be restricted. Protein should be around 0.5%, iron, calcium, vitamin D, all these should be a part of your normal diet. And phytoestrogens like soya should are an important part of your diet, especially in perimenopausal and menopausal women. What happens after menopause? Basically, your period stops. So what happens is there is a decrease in the estrogen content. And what happens because of that? As I said, there's a decrease in the metabolism. Patient is having menopause. There are changes in the energy levels. Memory gets affected sometimes. There is an increased risk for heart disease, decrease in the bone health. You get, bones start getting weak. We say that there's osteopenia, there's osteoporosis. You get a DEXA scan done for that. There is weight gain happening. Some patients have urinary problems, urine leakage issues. There is fat deposition on the abdomen. So all these problems arise as menopause arrives, but not that all women have all these problems. And they are so the basic way to avoid is to have regular exercise, control your diet, have a healthy diet, and have healthy nutrients. If you're having snacks, have healthy snacks, and all that will really help in your overall health slowly. So I have enumerated or listed down some tips for an active lifestyle, which even if some of them, if you can incorporate in your daily routine, it will really help you in the long run. So what is it? It is you should have some amount of physical activity and exercise in your daily tasks. Okay. You should have goals which are achievable and challenges which keep you motivated and rewarded. Don't keep your goals set too high that you can't achieve them and then you lose interest in them. No, you have to plan and prioritize your activities with your rest periods also. So make a timetable, jot down whatever you have to do in the whole day to day, and give time yourself for physical activity also in between. And of course, rest is also very, very important. Give your time some rest, some ease, some you say me time. Yeah. Then use aids to help you stay physically active and able to do more. Give a good night's rest. Um, you know, it is better to not keep sitting all the day. Even if you have a sitting job, a better idea would be to, after every half an hour, have a 5-minute walking break. That really helps. Or lying down too much, or that basically comes down to less physical activity, and again, so that will affect your health. Cycling or walking to the local store instead of driving down helps us. uh, Use a public transport. You can, or if you have to park your car a little before your destination, and you can, walk down to that place. So that really helps. So gives you some kind of activity if you really cannot, spare separate time for your activities. Okay. And uh, involve yourself in activities which you really like. Don't force yourself to do something which you're not liking, because you'll eventually get bored and will stop doing it. So involve yourself in some sport or something which you are really interested in, or learn a new sport, learn a new dance. Getting involved in that will really help you stay fit and active. Now, coming to checkups, a clinical and annual health checkup is really, really important. Everyone, whenever you go for an annual checkup, see that a pap smear is included in that checkup, and ultrasound is also a must in that. And a mammography could be every 2 to 4 years, depending on your family history. You should include that also in your routine health checkups. And of course, if you have to prevent a problem, you have to get vaccinated. So we have, you must have heard that you have HPV vaccines now available in the market. So they are of two types, the bivalent and quadrivalent. So of course, the quadrivalent one is a bit more expensive than the bivalent, but it gives us really good protection against cervical cancer and 90% of genital warts also. And there are other concomitant diseases also which are related to HPV vaccine, or certain oropharyngeal cancers, stomach cancers, colon cancers, which are also avoided with this HPV vaccination. And yes, it is recommended for girls as well as young boys. Basically, it usually contains 3 doses at the total dose completes in 6 months. Thank you. And we are open for questions now. If you have any questions, you can ask me.
Thank you, Dr. Chaitali. We'll take any questions right now. You may post your questions here or on chat group.
Dr. Chaitali, we have a question from somebody. They are asking at what age, like, is there any age criteria for HPV vaccination?
Yeah, I mean, the younger, the better. So usually, see, the criteria is that it should be done before the first sexual exposure. So the age has now we've come down that 9 to 10 years is the ideal age, but up to 15 years can be given. And actually, it is advisable even up to 45 years of age. Now, once you're exposed to sex, then the efficacy starts decreasing, but whatever efficacy it has, it will really help in preventing cancer, which is a dreadful disease. So earlier the better, but yeah, up to 45 years you can give the vaccine.
Thank you, doctor. Another question we have is there any, for recurrent vaginal infection, somebody is having frequent vaginal infection, is there any ways at home, which we can do, which can prevent that?
See, there are several causes for vaginal infections, especially if it is recurrent. We really need to come down to the cause for the infection. So, as I said, there are several causes. It could be because of urinary tract infection. It could be infection because of the external genitalia, which is harboring a lot of bacteria, and that is causing the infection. Or sometimes the partner may be infected, because of which the patient is getting recurrent infection. So we really need to find out the cause and treat it. And once it is treated, then we have other options to prevent infection. Recurrent infection is that certain lactobacillus capsules are available, which you can have, which prevents infection. Or we have the lactic acid washes, which are there, which help in preventing infection or maintaining the pH of the vagina. So, yeah, these are the ways wherein you can prevent the infection.
Thank you, doctor. Another question we are having is how frequent one should do ultrasound in a year, or is it supposed to be every 6 months to see if everything is all right?
See, if you're doing a routine ultrasound or a sonography, then once a year is fair enough. But if you have been diagnosed with a pathology, say something like a small fibroid is there, and if you need to really track it, then once in 6 months is advised. Otherwise, once a year is also fine, just for routine checkup and to know that everything is fine. in the abdomen.
Are there any more questions? Dr. Chaitali, how does one get in touch with you in case they have any questions after the seminar?
Yeah, so I have my website, drchaitali.com. So therein you'll find my contact numbers and my email ID. So you can log into that, or if I have to tell you, then the number is 9920333633, and the email ID is info@drchaitali.com. So you can contact me on these numbers, and I'll get in touch with you. I think we have a question here. What are the chances of endometrial hyperplasia getting malignant? So basically, usually endometrial hyperplasia is seen more of in the perimenopausal age group and the postmenopausal age group. So if it is in a perimenopausal age group, we are still safe, and we can try medications to suppress the endometrium. But if it is in the postmenopausal age group, it is a little alarming, and we need to take quick action for that. So the first one is you have to do a biopsy first to check the stage of the hyperplasia. Hyperplasia has multiple stages, and depending on the stage, we have to advise the treatment. So if it is at a later stage, as in it has gone into cystic glandular, then the next step is pre-cancer and cancer. So then in that patient, the chances of it converting into cancer is pretty high. But if it is in a lower stage, then it will take time. But yes, if it is in a postmenopausal woman, it's always advisable to get it treated as early as possible and not wait for it. Now, is the finding out what would be the amount of time needed for it to convert is very difficult. In some, it progresses very fast within 2-3 months, and in some may take even 1.5 years. So we cannot predict the time, but yes, it's better to get it treated at the earliest. So we have another question wherein whether fibroid or uterus removal is better by open surgery or laparoscopy, and why. Uh, See, nowadays, when you talk about benign or even some malignant pathologies, the first treatment or the gold standard is laparoscopy, because it is, we can say it is safer. There is less amount of bleeding. It is a magnified view, so it gives us a better precision. The amount of hospital stay is very less. You get operated today, and next day the patient gets discharged. The mobility back to work is very fast. Our patients start walking from the very next day of surgery. They do routine activities in 2-3 days time. They join work in 7 to 8 days, even after a major surgery. So, and there is no compulsory bed rest required. When you undergo an open surgery, if it's a horizontal scar, the bed rest is 1 month. If it's a vertical scar, the bed rest is minimum 3 months. So that is like too much of restriction of activity, and you're really at home. So all that is avoided when you do laparoscopy. So yes, and any size, any amount of fibroids, any location, laparoscopy, every fibroid can be tackled and removed. Even if we have previous surgeries also, it is one of the best treatment options. So there's another question. How to know what kind of vaginal discharge is normal and what needs to be checked by the doctor. Also, if you're on medications, can that cause vaginal discharge? Well, that's a good question because we have many women who really don't understand this vaginal discharge. Is this normal? What do I do? So, some amount of normal discharge would be present to moisten the abdomen throughout. And well, this increases before periods. So, a week before periods, you may have the discharge a little more and maybe slightly thickened. That is normal. But if you start getting a lot of discharge, which is colored, foul smelling, or curdy white, which is throughout the month and is persistent always, then that vaginal discharge is not normal and it really needs treatment. And medicines usually do not cause any kind of vaginal discharge. That vaginal discharge is majorly caused because of infection or vaginitis, depending on what is uh, the cause in that patient. So, apart from Kegel exercises, are there any other ways where one can treat urinary incontinence? So, Kegel exercise is basically the treatment modality which can be done at home by the patient. So that really helps in basically strengthening the muscles which are undergoing atrophy or getting weakened by the age and which is causing the urinary problem. So that is usually the first line of treatment that we advise. Secondly, there are, depending on the type of incontinence, there are some medications also which really help in decreasing the incontinence. So we really need to find out the cause of incontinence. Sometimes the cause is UTI also, which causes urine leakage problem. Sometimes because of a fibroid which is located anteriorly, it's pressing on the bladder and it's causing incontinence. So if the cause is treated, then the incontinence is also treated. And after Kegel's exercise, the third option would be a surgical procedure. So there are urinary incontinence procedures which are available. There could be some stitches which can be taken to just lift up the neck of the bladder, which will prevent the incontinence. Sometimes a mesh needs to be put in to treat the incontinence. So for fibroids, when is surgery and hysterectomy recommended? Can it be avoided? Well, as I said, every fibroid does not require treatment or surgery. So some fibroids which are too small, which are not causing problems, which are not at bad locations, can be left behind. They are non-cancerous tumors of the uterus. So they really do not turn into cancer normally. It's very, very rare that a fibroid turns cancerous. So they can be just left behind. When a fibroid has become big and it has started pressing on the neighboring organs, as I said, causing urinary problems, causing bowel problems, pressing on the ureter and causing swelling of the kidney, or it is causing bleeding problems, recurrent bleeding, heavy bleeding. So, or even a lot of back pain some patients complain of because of the size of the fibroid which is pressing on the spine. So in such cases, yes, surgery is advised. And hysterectomy or uterus removal is done in cases where the patient has completed her family, usually more than 35 years of age. In the younger women who have fibroids, we usually advise a myomectomy surgery, that is just removal of the fibroid. And can it be avoided? Well, fibroids cannot be avoided. They just grow because of the hormones. They feed on hormones. Well, if you undergo menopause and your estrogens have stopped functioning, yes, then the fibroids will really stop growing, and they will also shrink to around 30% their size and then stay there in the body, but it will not cause a problem. So if I have stopped breastfeeding my baby, how long will I still be lactating? Does that affect the hormones, menstrual cycles, etc.? So if you have stopped breastfeeding, normally we advise that you need to stop expressing milk. Okay, wear a tight bra for a few days. Usually milk secretion stops between 5 to 7 days, max to max 2 weeks, that is needed if you do not touch your breast. And once breastfeeding stops, basically breastfeeding usually doesn't affect the hormones, so stopping it also doesn't affect the hormones in any way. The hormones continue to function normally, and initially when you have started breastfeeding, menstrual cycles could have got little irregular, but they come back to normal. So stopping breastfeeding usually doesn't affect that much in any way. Another nice question is, are there any chances of a new pregnancy during lactation? So what we say is that if you're exclusively breastfeeding, it is a natural contraceptive, which means that usually patients do not conceive if they are exclusively breastfeeding. But once you start weaning and uh, it's irregular, then the secretion of prolactin and the oxytocin is not regulated, then that is the time when patients can start getting pregnant. So usually 98% of the times, if you're exclusively breastfeeding, patients do not land up with a pregnancy. There's another question. My 5-year-old daughter holds her pee for long duration. Will that cause issues in the future? Well, um, holding your pee is not a good idea, neither for children nor for adults. It basically increases the chances of urinary infection in the girl or the woman. So it's always a good idea, if there is a good hygienic surrounding where you can go and pee, you should go and pee instead of holding it for longer periods of time. Also, drinking a lot of water at frequent intervals is very important to keep on flushing the kidney and the system, because urine also contains a lot of bacteria. It harbors bacteria, and the more it stays inside, or it's like collected water inside, it is going to increase or multiply the bacteria. So these patients do have subclinical bacterial infections also, and they are prone to get a bacterial infection easily. Sometimes it can also, they can be prone to stone formation because the system is not flushing out quickly. So this causes deposition of crystals inside and causing stone formation. So always you should encourage your child to pee at regular intervals. How often do we need to get the female child checked from a gynac? Is that necessary? Well, usually not necessary. It's not about being a female or a boy. Uh, Pediatrician regular checkup is required as per the vaccination schedule. After that, usually we do not go to the pediatricians, and young girls and all normally do not have uh, growth problems or gynec problems. They usually start arising after menarche or after they have started menstruating. But yes, but if you have a doubt, as in there is lag in the hair growth happening, or there's a delay in the period, or there is some intermittent pain or cramps happening in the abdomen, then it's a good idea to get your daughter checked from a gynecologist. What are the tests recommended for infertility? Well, when a patient comes to us with infertility, there are a whole array of tests that we advise. So, starting from routine blood tests, we do the hormonal profiles, also the gynac hormonal profiles, basically, which would include FSH, LH, prolactin, AMH, thyroid. And then depending on the case specific, if we need estrogen, progesterone, so those also can be done. Then sonography, routine sonography, or tubal patency tests. These are normally then a husband semen analysis. These are the routine tests which we usually advise for infertility patients. Some amount of routine tests, as in CBC, urine routine, and liver renal function tests, are done for the husband also. Also, we do the infection tests, as in the torch titers, the HIV, HCV, HPSAG infection, the sugar test, HbA1c. So basically, most of the routine tests are covered, and also blood group, not to forget. That is also an important part of the routine test for infertility. What would you advise as a daily hygiene for a girl child to build good habits and avoid infections, etc.? So if we have young girls, we have to really advise them that that this is an important part of the body, and it has to be kept clean. We have to teach the girls how to clean the area. The little sulcus or the grooves need to be cleaned properly at least once a day, if not twice a day. We need to change the undergarments every 12 hours. That is the best hygiene. And I think for young girls, that is it. Once they get into menarche and start menstruating, then a frequent change of pads every 4 to 6 hours is advisable. A good hygienic or sterile sanitary pads is what is needed for good vaginal hygiene, because when you're menstruating, the cervix opens up and chances of ascending infection do increase. So more care has to be taken at that time. Basically, frequent change of undergarments, cotton undergarments, and something which you are comfortable with wearing throughout the day is what is advised uh, to have a good hygiene. How does one tackle the symptoms of PCOD? Well, there are multiple symptoms in PCOD which patients come up with. So, um, so if there are delayed periods which patient is facing, then we give them menstrual regulatory hormones, which helps to bring the FSH, LH under control, and it helps in getting the periods normal. If the quality or the amount of flow is very less, then we give medications, or there are Ayurvedic preparations also which help in increasing the amount of flow in the patients. If they are having excessive weight gain, then thyroid, and then they are usually hypothyroid, so thyroid hormones are started, along with which we advise regular exercise, which usually helps in also controlling the menstrual hormones, side by side, along with increasing the ovulation and keeping the patient healthy. And weight loss really helps in these patients to get things under control. Well, if there is complaint of excessive hair growth on the face, then the anti-androgenic hormones are advised depending on the levels of the hormones. This helps in getting these hormones levels back to normal, and it prevents further hair growth. But the hair growth which is already there needs to be tackled or treated by either waxing or shaving or permanent methods like laser. So depending on the problem, we advise treatments for PCOS. Why do we feel decrease in sex libido during breastfeeding, and what can we do to make it better? Well, uh, there is, as such, uh, there is no hormonal milieu which is causing this, but basically the complete attention, or the whole attention is captured by the child, especially when it's the first child. The parents or the mother is actually very apprehensive about taking care and really giving the best and giving the most amount of time, because of which there is a shift, and there is probably a little aversion to sex. But otherwise, there is no such decrease in sex libido. Yes, but after after a year or so also, if that continues, then yes, that needs to be investigated. There could be a hormonal imbalance which could be causing this, which can be treated. It's more of a mental makeup. We also have medicines for that, which really help in getting your sex life back to normal. Well, it's and also what happens many cases, if it's a vaginal delivery, then getting back to your sexual life is delayed, especially if there has been a third-degree tear or a cut at the vagina, which takes time to heal. So sex is a little painful in such cases, because of which also it indirectly affects the sex libido, which is also one of the commonest causes, wherein a lot of reassurance and medications, and we have a couple of gels also which help in alleviating pain, which really helps in getting the sex life back. So do you recommend using vaginal washes, etc., that are in the market? Usage of soap in the vaginal area also is pee safe, etc., safe and recommended to use when you are traveling. So vaginal washes help in maintaining the vaginal pH, but I advise that only for a certain amount of time. You cannot be using it for months together. It can be used max to max for say 1.5 months or 2 months. Then we advise you take a break for a month and then you can use it again. Continuous usage also causes washing of the cells of the vagina, which in turn also exposes the patient to further infections, and irritation and itching is what the patients complain of. So, continuous use is not advisable. You can use soap. See, normally we do not use any kind of washing inside the vagina. See, for the external genitalia, soap can be used. It's a normal thing. Inside the vagina, usually nothing is needed. If at all, you can use the washes, but not soap. Uh, Be safe when you're traveling. Yes, it is a good option. You can use it provided you're washing it nicely after every use. When you are really traveling and instead of holding on to the urine for long periods of time, it's a good idea to use it. Does using a public swimming pool increase the chances of UTI in the female child? Well, nowadays we have very hygienic and good public pools available, which are well chlorinated and well maintained. In such cases, it does not cause any kind of infections. It's actually safe to use them. But public pools which are really overcrowded, which are not hygienic, not maintained, well, it's a chance. It will not increase the chances of infection, UTI, but yes, it can cause vaginal infections and itching and skin problems. All these can happen in such in unhygienic conditions. So if there is an unhygienic pool, yes, once in a while is okay, but routinely using it is not advisable. Now, what are the type of OC pills and what are the side effects? Well, when we talk of OC pills, the main reason for using these pills is basically to prevent ovulation, which in turn acts as a contraceptive device. So we nowadays we have very good OC pills in the market. They basically contain low doses of estrogen and progesterone, which helps in maintaining the endometrial environment at a low level, which prevents ovulation and also prevents implantation of the embryo. So these pills, as I said, these are very low dose pills nowadays that we get. So they have very, very minimal side effects, or you can say no side effects now. So otherwise, if you say routinely, yes, these patients usually complain of a lot of nausea in these with the pills. So nausea can be avoided by keeping the timing at night. So if you usually have the pill at night, the nausea part goes away in the night sleep, and usually in the daytime, patients do not complain of nausea. That is the most commonest cause. Otherwise, some patients do complain some amount of bloating or water retention happening, but that is really temporary and it goes away once you stop the pills. So those are the most side effects. Otherwise, if you talk about the bad side effects, yes, it can affect if patients are using more than 35 years of age, then it can, you have to see that the liver is functioning normally. There is no history of thromboembolism or heart issues, IHDs. So all these are the dreadful side effects at higher stages. Of course, these are also more prevalent in when you are using the high dose OC pills rather than the low dose ones. Uh, so what are your thoughts on menstrual cups? Are they better or worse than pads? Well, menstrual cups are nowadays coming up in a very big way. They are considered easier and more hygienic uh, because they lie inside, they collect the blood. Once it is full, you can really wash it and reuse it. It's pretty safe. And we have seen that the pads or some of the pads, especially the ones which have the dry weave covering and not the cottony ones, they contain certain chemicals which are harsh on the skin, harsh on the on the labial skin. Some patients come to me with erosion of that skin or itching in that area after using these pads. And so the toxins that are released from this, once that comes in contact with the menstrual blood, these could be a cause for a vulval cancer in future. So, but usually nowadays we get organic pads also, and we get the cottony ones also. Those are usually safe, but if you're using the dry weave ones, you have to be a little careful. In that case, menstrual cups, all of them are fine because it's directly collecting blood from the cervix. So that is a better option. But yes, menstrual cups cannot be used in unmarried girls, and you have to be comfortable wearing the cup in the day. So if you're okay with all that, then yes, menstrual cup is an option.
I think this is a good place to end it. Dr. Chaitali, thank you so much. We will be making the recording available for everyone to use on our YouTube channel. And I'll put down the ways to contact Dr. Chaitali as well. So you can use that information to get in touch with her. Thank you so much, Dr. Chaitali. It's been a pleasure having you here, and I hope you have a nice day.
Thank you so much for inviting. It was a lovely interaction. Thank you so much.
Thank you.